The name of this class tonight is just putting your best foot forward, natural strategies to keep your feet and ankles strong, stable, and capable as you age. Presented by me, Dr. Jeremy Trunk, and then also my lovely other assistant therapist here. Elise will be joining and giving some lovely information tonight as well. So should put her name at the top there too with it, but she gets to slide in a few more. So this is me and my lovely wife, Sarah. We are co-owners and founders of Balance Within PT. And really, the main reason we're here tonight is we just really want to give education, really give good quality information, and what everyone does with it is up to them with it. But just really want people to see an alternative approach to just surgery, medications, injections, passive treatments such as orthotics. And there's nothing wrong with orthotics inherently, but it's not an end all with it. So I really want to share just a good amount of information just for better understanding. That is the main purpose of tonight. Couple of quick housekeeping things as this is already happening right now. This will be recorded and we will have time for Q&A at the end. So um, feel free to ask anything you want. If you can always type it in the chat as we are going along with it, or otherwise we just save the questions to the end. We'll have some time for some Q&A. If you don't want your face to be shown on the replay, just turn your camera off. Please make sure the mic is muted just to minimize any background noises. And then, as I just mentioned, if any questions arise, just please feel free to type something into the chat. This really is for informational purposes only. This really should not and really cannot replace a thorough evaluation by a specialized physical therapist with it. And for those attending live who make it to the end, there still will be a drawing for a free treatment session for anyone who does attend all the way to the end tonight. A quick bit about us, why we are doing this. So I mentioned like wanting to share information, but even beyond that, like why we exist. Balance Within PT in 2015. As of this Friday is our 10-year anniversary with it. So reason why we started this is we really wanted to provide a better solution for people to overcome their pain, their limitations, address missing links for their problems, get back to their active lifestyle. And a big why is for a lot of my journey with this as well. So suffered from the biggest thing. I've had a lot of body aches, but the low back was my biggest issue for over 20 years. I was in a bad ski accident, but there was a lot of other things feeding into it prior to that. But I've been through that route before. I've been through that going to the physical therapist, the chiropractors, the pain specialists, the massage therapist, the acupuncturist, the MRIs, the doctors, the orthopedics. I've been on the carousel with this. And also being a clinician in the mill setting and also seeing the limitations that can come from it, whether it be insurance limitations or working in a high volume setting, is one of the reasons why we exist as we do today. So at this point, having helped over 1,000 people get help to highly specialized care and improved outcomes over the past 10 years, something we are very proud to have developed a reputation of being able to help fix problems where other therapies have come up short. Over 110 five-star Google reviews from other patients. And then we are voted in top physical therapist through Lake Country Family Fund for the past 5 years running. So that's a bit about us. One of our big things is we help people age 40 plus looking for physical therapy in Delafield and beyond to find lasting solutions to aches and pains naturally so that they can get back to active lifestyle, take part in the activities they want, be able to still not have to rely on unnecessary medications or surgeries. Who is this class for? The class really isn't just for limiting foot and ankle pain. Really, it's for someone who really wants to go after root causes of their problems with it. Someone who wants to really be able to continue to hike on the trails with their friends or go for a walk with their grandkids or play pickleball, be able to walk on an unsteady surface like walking on the beach, walking on the sand on a warm sunny day, be able to work comfortably in their yard, or even just ultimately just having confidence in their body to be able to work for them well as they age. And there's a few people who already said that tonight. So if this sounds like you, if you got pain in the toes, the feet, the ankles, or the body, if you want to be more active, but you can't due to this pain, or you're just afraid of making it worse after, if you've tried everything, whether it be chiropractic, PT, injections, meds, surgery, orthotics, acupuncture, and you're still struggling with it, or you've just been told you're just going to have to live with the pain, you're in the right place. So what you're going to learn tonight. So big thing I want to point out is missing links. driving your foot pain and ankle pain and probably driving you crazy. Problems with your footwear, problems with orthotics. I also want to teach a couple foundational concepts and exercises to help your feet and body right away with this. I think a big thing I really want everyone to go into the main information with is don't listen for just how to like fix your problem, because I'm going to pick out a few specific, just a lot of generals that most people probably already have in here tonight, but don't listen for your problem because really every part of this class applies to you. We're not trying to just say this is this, this is that, this is this. This is all together. So about me, um, I've been a doctor of physical therapy for over 20 years, orthopedic and spinal specialist, advanced John Barnes myofascial release specialist, recovery from chronic back and body pain after suffering from over 20 years, co-owner, founder of Balance Within Integrated Physical Therapy with my lovely wife, Sarah, with also being a father, husband, hiker, biker, and musician. So there's my little one there. That's already a couple of years old now. She's already getting so much bigger. She's 6, but she's got tall genes. If you can't see on the video, but for those who've seen me, I'm tall and lanky. I've got 6'4" genes in me. My story. So I mentioned the ski accident, and that was always like the really big one with it. But broken foot at left foot at age 2, and then torn left ACL at age 18. And I don't think that's a coincidence that that was on the same side. Um, Ski accident at age 14, that broke my collarbone and displaced multiple levels of my vertebrae and spine. Went around to multiple MDs. Was told you sprained your back. You're just gonna have to work through it. You're gonna have to live with it. As I mentioned previously, I've seen all the carousel: PT, acupuncture, pain specialist, chiropractic meds, X-rays, MRIs. I'm not saying that they didn't help to a certain extent. I mean, there was temporary, there was relief, but it was small amounts to really not break free over that cycle. And then after continuing to tell my story, I was told by multiple providers, you're just going to have to live with the pain, which is well as one of my biggest pet peeves in the medical world. For me, I was really worried about my ability to do my job in my 20s. I would say if I hurt this much now, what's my life going to be like X number of years from now? And truly, like, am I going to be able to do my job? Legitimate like thoughts that go through your head. And then beyond that, it's like even just worrying about life, but life and work, I wasn't sure how I was going to be able to do it. In the early years, I took ibuprofen daily. I would get Costco bottles and take ibuprofen 2 to 3 times a day. My stomach really rebelled against that. Terrible acid reflux for years. I haven't had acid reflux in 15 years, but ibuprofen does not help that. I had problems with my breathing pattern. I'm not gonna be able to get into that as much tonight, but that makes a huge difference in terms of how you stabilize your body if you breathe in properly. I was able to finally unlock my body with some myofascial release through the John Barnes method. It was a very unique circumstances of just multiple just injuries at a young age and tension in my body. And I can't guarantee this for other people, but after going through a few months, it's actually probably over like 6 to 8 months between self-treatment and seeing myofascial release. I went from 6'2" to 6'4". So it can't guarantee the height's going to be there, but it shows that there is some really potential hidden relief that can be with some of these specialized tools. And myofascial release was one of the big ones that we use at our practice here. As right now, I do live actively pain-free day to day. Yes, things can fluctuate, but I know how to get things back online, get things back behaving with it. So that way I can still continue to hike, bike, play music, be a father, be a husband, be a PT for 20 years and counting. For me though, like I'm lucky, truly, like I am lucky. Not many people can say this story that the older I get, the better I feel in my body. But like that's what happens when you live life at chronic pain at a young age, and then you learn how to take care of your body, and you learn how the body works much better together as one whole unit with this. But the big thing is that we all have the capacity to improve and feel good in our body, no matter how long the pain has been there. And so really what I want to share are some of the missing links that I use on my journey to help reclaim some of my body, but also stuff that we teach our patients every day to help overcome their stubborn foot and ankle pain. I put foot and ankle in asterisk because really it's taking care of your body. I'm going to pass it over to Elise. She's going to introduce herself before she says her slides, but I'm going to let Elise jump in here for a moment.
Yes. Hi, everyone. Is everyone able to hear me?
I can hear you.
Okay, perfect. My name is Elise, as Jeremy said. I am a physical therapist assistant. I've been with the practice for almost 6 months now, and I do sports medicine, orthopedic, also have done a lot of work with spine, myofascial, as Jeremy mentioned, and then women's health as well. I am a collegiate volleyball player and actually had foot injury that required surgery firsthand, so that I limped along with for about 3.5 years before going through a surgery. So I am very familiar, and foot and ankle problems are near and dear to my heart. And then, yeah, so I understand what all that pain is like for you guys. I am currently in just an auntie, and then I still coach volleyball, so very active in it. And my goal is to help everyone get back to doing what they love because when I couldn't, it was really bummer. So I want to help everyone get back to doing what they can, and feeling better without all the pain that comes with foot, back, hip, knee, all the things.
Yes, perfect. Thank you, Elise. And I think that's all just such a like important point to we're clinicians, but we're also patients at the same time. We're still human beings. We still have a history. We still have a body that has had a history, has had traumas and accidents and injuries, or just chronic stuff that has crept up over time. So, I always say like to someone like, when I'm teaching you, it's not just because I'm just telling you to do it. It's because we've had to walk this oftentimes as therapists as well too. So we're in it just the same. Um, all right, let's jump on in here. So Leonardo da Vinci, there is one man who knows a heck of a lot about engineering and art. And his take on the foot was the human foot is a masterpiece of engineering and a work of art. And it's truly an incredible structure in the human body for what it can do, what it's capable of, and how it supports us. I heard that line a number of years ago, and I've always been trying to remember it. And then recently I was doing another foot class, and they had it as one of their first slides. I was like, oh, finally, I could just capture this right here. So this is one of my favorite lines about the foot. Um, so anatomy of the foot, there's going to be a quiz at the end here. Just kidding. Either way, I just want you all to have an understanding, really like what's going on in your feet, and really kind of just there's a lot more going on in this. So 26 bones in each foot, but in total of both feet, 52 bones total, which is literally 25% of our entire skeletal structure of just in terms of just number of the bones is just in our 2 feet. It's got 33 joints. There's 29 muscles that really impact it. So there's 19 muscles in the feet, and those little guys really do play a large role, which is a large shift from where actually a lot of some of the research was even 10 years ago. And there's 10 muscles outside that influence it. There's over 100 ligaments. Some areas of medicine say up to 112, and there's thousands of sensory nerve endings in there with it. And that is something as human beings we have gotten so detached from in terms of ability to feel our feet, whether it's through our footwear, through walking on man-made just flat surfaces. We have gotten so far removed from the way that nature designed our feet to actually be able to step on uneven ground, on rocks and sticks, and be able to change shape and have that feedback of what we're doing, where we're at, and it's amazing to try and just get people to just feel their feet, and just I'm trying to say like, hey, when you stabilize your feet, just try and feel these few points. And some people are just like, that's so much for me to think about. We're trying to get you to think of 3 points for thousands of sensory nerve endings. We're trying to get you back to the way that nature designed you with that. But it's an amazing, amazing structure. When we look at the ankle, truly there's only like three true bones for the ankle joint, but really we're looking at it as the ankle and the foot as being just part of the complex with it. So we're not really going to talk about anything separate tonight, but just in terms of just more just like for like an FYI, in terms of like how the medical system views the ankle, it's three bones and creates a mortise joint. And I put a little diagram at the bottom of what that mortise joint looks like. That's what they call the ankle joint as well with that. You can see that on the right side. Love that diagram there, but it's okay to not have that full understanding of it. But just it's this is all just part of an entire system anyways. So what causes foot pain? Well, maybe it's as easy as going to the doctor, like this sweet little gingerbread man over here. He says, that's why your feet hurt. You have candy corns. Yeah, great, great, sweet. But why do you have candy corns? Do you have too much sugar intake? Do you have too much frosting in your shoes? Like, truly, like if you go to a podiatrist, like, hey, I have this problem, but why? So some of the main things we are going to look at today, footwear, weakness in the foot, the leg, the hip, the core, stiffness in the muscles and the tissues in the joints. Going back to the other side there, even just in our feet alone, 33 joints. 33. If those joints, those joints are all stiff and not even be able to do their job, you think your feet or the rest of your body is going to be able to do its job as much? No. Oh, great. Now it's asking me for an update on the printer right now. I'm going to just, what? I'm just going to disagree on this. Sorry, guys. Um, so, other things, sitting or standing all day or a posture, basically meaning how do we use our body? One of you guys, Deb, you shared that you were on your feet for 40 years as a nurse. Do you think that played a part of it? Probably did. So that leads to one thing, mechanical imbalances. And so this is like the muscles, the joints, the nerves, the fascial system, and just the body alignment. But mechanical imbalances, I'm going to come back to that word. It's actually a good thing though, mechanical imbalances. Top four common foot and ankle problems. So these are usually the top four that are seen in not only in our clinic, but also just in general, whether it be podiatrist or just orthopedics, you name it. These are usually like the most common areas. So plantar fasciitis slash heel spurs, Achilles tendinopathy. So tendinopathy, that's like your tendinitises or just tendon problems. Bunions, or then we also have forefoot pain. And it's kind of grouping some of these in together. If some of you have maybe been labeled with neuromas or metatarsalgia, this is all kind of just grouped into just like pain in the front of that foot there. So going into that first one, plantar fasciitis slash heel spurs. So just like in general, just like the symptoms, pain near the bottom of the heel, pain in first few steps in the morning or after prolonged sitting. And oftentimes it's weak foot and leg muscles with that. And that fascial system, that connective tissue, that passive support takes on more of the load. And you can also like, and whether you're high arch feet or flat feet, I wanted to put both in here on purpose because sometimes people will say, oh, I have this because my foot is this way, or I have that because my foot is so and so. Like you can have problems no matter which foot. It's just looking at all of these pieces together with it. So, but if you have high arch feet, usually your problem is going to be more of like a poor shock absorption. It's got the tissue and the joints are not as pliable. If you have an overpronated foot or a flat foot, you still gonna have pain maybe in the same spot with it, but your problem might still have that weakness, but you have that inability of the tissues of the muscles to be able to actually push off when you're walking and have that stability with it, and then it's overstressing that tissue with each step. And you can still have tight calves, and that can pull into the foot. And there are some areas of medicine that will argue that the plantar fascia and the calves, and even if we go further up, the hamstrings and even further up there, it's all one piece of tissue with it. But if we're just staying locally with it, the calf muscle, the Achilles tendon, and then the bottom of the foot, in reality, it's pretty much all the same tissue. So that's why if you have plantar fasciitis, like oftentimes like you're still working into the calves as well. It's all continuity in the same piece of tissue with that. And then heel spur. So I just want to put this on there with it. I don't want to disregard in terms of the impact if someone says they have a heel spur, because I know they're going to have pain, but a heel spur is really not what is causing your foot pain. And I know that just like the connotation of like what a spur is, like you think of like a sharp, pointy thing that's kind of jabbing with it, a spur with it. But if you can see in the photo there where it says a heel spur, and it kind of does look that way, but how they diagnose is they'll take an x-ray from this lateral view of the foot. And if that little bone is protruding out, they call it a heel spur. But what really is happening is when that tissue on the bottom of the foot is really tight. It's pulling on the bone, pulling on the bone, pulling on the bone. And yes, there's irritation to the tissue and maybe the insertion. But then the bone starts laying down calcium because it says like, oh, I'm just being told a message to just, I'm supposed to go in this direction. And it starts laying down calcium. So just for people who come in and attach to like it, like, oh, like I can't do anything about this because it's a heel spur and it's a surgical case, it's absolutely false. Um, Achilles tendinopathy. So some of just the general Ones with this is like in the photo it shows it there too, whether you have a Haglund's deformity, that's very similar to a heel spur. That is something that is getting pulled on time and time and time again, and then the bone starts laying down calcium. So the bone starts changing shape in response to stress. So that tight tendon, it's going to get irritated, but you're still going to find some of these other factors, and it all kind of gets grouped together. So contributing factors. So you can say people who've used heeled shoes. Heels are in heeled shoes is in quotations more so because it's not just high heeled shoes. Sometimes even just like traditional athletic footwear that has a high heel and then a lower forefoot with that is still putting that foot at more of a tilt with that. So that can still drive tight calves with it from footwear as well. Weak calves. So weak calves can contribute this as well. Ellen, you were mentioning this as well with some of your issues that you're finding, hey, this is also more of a stability issue as well. But you can also have the calves to be tight and weak. So sometimes you need both. You need to stretch it and strengthen it. And then weak foot intrinsics. So those little muscles inside the foot, those are the ones that when we're pushing off for walking or running, those are the ones that are really supposed to be giving us that stability locally in the foot to help get that push off. Um, and again, that research has changed. Before the past decade, everyone was more so saying this is all passive structures. It's the ligaments that's doing this. It's the fascial system that's doing it. And the research has changed. It's stability of the muscles in the feet. Bunions or bunionettes. So whether you have the big toe or the pinky toe going towards the midline of the foot, there's a few main drivers with this. So usually tight calves, so poor ankle or midfoot mobility, tight calves or the midfoot does not move as much. And both of them is just the foot is trying to, with each step we take, it needs to be pliable. And if things aren't working the way that they should, things start changing and the bones start trying to adapt in areas and ways that they're not meant to. And so they start to change shape. So between that and then the narrow toe box shoes, that is a big one that we're going to get into today. Is the footwear also contributes a lot to this. And this is not just dress shoes either, guys. This is oftentimes even athletic shoes that can be compressing this as well. And again, poor foot strength as well. I'm pointing that again. You see some common threads already. Forefoot pain, the metatarsalgias and the neuromas. So in general, this is someone who's getting increased loading of the forefoot. So heeled shoes that then again is going to get brought into play here, and tight ankles because more pressure is ultimately towards the front side of your foot. A narrow toe box shoe once again, because as we start to compress things, those areas aren't able to splay out and they can start compressing the metatarsal bones or even the neuromas, which is the nerves between the bones with that. Weak foot muscles. Here we go again. You get collapsed arches, poor pushing off with that, and we're getting more force into those other kind of static structures that are just working more than they should, that nature designed them to do. And maybe improper push off. So that means not pushing off through the big toe. And some people, depending on maybe old injuries or surgeries, aren't even able to do this. But the more we can get you back to when you're walking to be able to push through the base of the big toe and start offloading those other toes, that could be a huge difference in terms of just changing the way your body works and start offloading that area just from a movement standpoint in day-to-day activity. Driving factors of foot and ankle pain. So yeah, this 8-year-old behind the wheel over here, I'm not worried about him doing that. I'm worried about those shoes that kid has on there. So these shoes are going to give me problems when in my 20s and beyond. This kid is angry. He should be furious, and he is. So that's probably what the road rage is coming from with that. So the shoes. I mentioned these guys, and here's some of the photos with it. And when I was putting this class together, I was doing a search for even just like narrow toe box shoes and just kind of seeing what comes up. I couldn't find anything with it. I just started just looking up just dress shoes and then running shoes and then just finding these photos here. You can see even just like in the middle photo of how the shoe shape is compressing the pinky toe and the big toe together. So that bunion and that bunionette. They don't always have to go together, but you can see right there in that photo how you start to take both those toes and start pointing them to the midline of the foot with that and how that footwear can contribute. And even a shoe that's a little bit wider can still be considered something that's going to contribute to it. Ideally, what we're looking for is a type of shoe that our toes can splay out in a little bit. So I don't look at everything as a one size fits all. We will get into just a little bit more footwear pieces of this, but something that allows our toes to be able to splay out because that's a huge driver of our balance and our stability coming from that forefoot. It really should be the widest part of our feet. And oftentimes the way that our modern society has shaped us literally is it starts to become the narrowest part of our foot. So the problem, so I was just mentioning, narrow toe shoes puts constant pressure on the toes and it changes the shape of the forefoot. Does that does that foot shape look familiar to that shoe shape? So I kind of just superimposed that image over to kind of just really, I just took a picture of bunions and then superimposed another photo on top of it and it worked very nicely. But you can see a very similar showing with that. So once this happens, though, you lose foot stability. You have less ability to push off correctly. You lose balance. You might even have your feet will flatten further from that because those muscles aren't doing their job. And then you're going to get more pressure on those lesser toes. So like the metatarsalgia, the neuromas, more problems. So the heel part of those shoes is that the heels will put the calves in a shortened position, often limiting that ankle's ability to bend. And then that movement is that the medical term is dorsiflexion. So we're going to come back to that a couple times tonight. That dorsiflexion is a key movement of being able to move. So we need that with walking and with other functional movements, whether it be like anything like a squatting or picking something up or doing stairs. It's all of our movements during the day that could be driving different changes in our body with that. So like even research shows that a high-heeled shoe wearer is going to be double to triple more likely to develop a bunion compared to someone who is a flat shoe wearer. And I want you to look at the diagram in this right here. So as they have like the A, B, and C, on A, you just see a body just standing flat on the ground, nice and level and aligned with that. And then someone who's in a heeled shoe as to like the center of gravity of where that's tilting your body. So, and then in the C picture with that, if you look up the chain, you're going to see differences in how the rest of the body is changing. You're going to see differences in the back. You're going to see differences even in the shoulders and in the neck. You see, and this is where we might see differences in someone's posture where they come in like, hey, like I have this problem in my neck. Sometimes some people come in with their neck and we say like, okay, we're gonna start working here, but for us to get to the root of the problem, we need to get down to your feet. And you can see it in that photo right there on how that changes things up the chain with that. And it doesn't have to be just high-heeled shoes, but this is a easy visual representation as to how our foot shape and our footwear can really change our entire alignment up the chain with that. Which just goes to show Cinderella is proof that a pair of shoes can change your life. So poor Cinderella, I'm just envisioning this 30, 40 something year old Cinderella living in the castle with, I don't know what if this was Prince Charming, who she ended up with. Forgive me, and I'm a girl dad. Maybe I should be ashamed of myself right now. I don't remember who she ended up with, but but she had that glass slipper. Terrible support, terrible height. Do you think she wore those all the time? I wonder what her feet are looking like if she was still around today. Poor Cinderella. So, a partial solution. So, this is a piece of it, but getting back to the footwear. So sometimes people will ask, like, what type of shoe should I be wearing? Like, what brand should I be wearing? Footwear has expanded immensely in the age of the internet here. You can order shoes online, have them on your doorstep tomorrow, try them on it, or get them shipped back the next day if they don't fit. I would say there's more principles we want to look at, and it's not a one size fits all. As I'm right jumping down to the bottom of the slide, this is not a one size fits all approach with it. So I want you to just understand though as to what some of the general things one should be looking at for their footwear in the long run with it. Some people with medical histories of surgeries, you're going to need supportive shoes. You're going to need orthotics. So regardless though, the generality is that you need a wider toe box shoe. You need your toes to be able to move and splay out. again, going back to the way that nature designed us, is that the forefoot should be the widest part of our feet. And in reality, most of the feet that we see is probably one of the most narrow, if not the narrowest part of the foot, which is the exact opposite of how our design was meant to be. So between the wider toe box field to give our toes the ability to splay out, get those muscles in the feet working more, give us better balance, get us better support, and then allow the muscles even up the chain to work a bit better, even just from that can make a huge impact. But other areas that we would want to look at is what's called a zero drop shoe. A zero drop shoe is just the distance between the sole of the heel of it to the front of the foot is basically zero. And again, for some people, this is maybe a gradual transition if they're really looking to get into that type of footwear with it. Some people, it's not appropriate. Some people, especially the younger ones, you might need to start looking at the bigger picture in the long run with it and start picking out some different shoes for different lifestyle choices for your feet and your body to work better in the long run with that. Another partial solution, orthotics. In full disclosure, we use orthotics. We have custom orthotics. This scan right here is an actual just screenshot of, was this mine? No, no, this was not. So um, this right here shows a scan of the feet that we use on our 3D scanner, and then it will give an outline of what this may be doing to the rest of your body. So orthotics, they can be a huge assist to that body, that all those areas upstream, the knees, the hips, the back. If those feet are collapsing with each step, that is going to change everything up that chain and upstream with that. So orthotics can absolutely help all of these areas and prevent whether it be further collapse in the feet or if a foot is just really flat, give it that support underneath there so you actually can still move around longer and better and go for a hike. But the thing is, orthotics are not an end-all solution. And I can't tell you how many times throughout just my years as a clinician, someone has come in and said, like, well, my orthotics don't work. Are they bad orthotics? Sometimes, yes. Sometimes they're just not the right orthotics. But oftentimes it's just that they're looking at the orthotics as like one of the main things that's trying to fix their problem, and it just doesn't work. The Good Feet store, they do a hell of a job marketing. Like, and they have the people on there, this is a real patient, and they say, and I had this and this and this problem, and I put those foot inserts in there, and that pain went right away the second it was in that store, and it hasn't come back. I'm not buying it, but regardless, though, they help. They do help, but regardless, though, if you look at even that picture on the right, when you see a body that has been off kilter for so many years and one pelvis is higher than another, and you're having like SI joint pain or back pain or those shoulders and neck, and you're having that pain there, I don't buy that. Excuse me, my gum was almost going to spit out on me here. That's very unprofessional. Um, all that orthotic is not going to fix that whole system there. You might be having now muscle imbalances from every step you're taking. Maybe one muscle is working harder and another muscle is turning off. You need to wake up that other muscle and get that back to the party, get that back doing its job. Orthotics are going to be a piece of the puzzle, but never an end all. So a broader view. Yeah, we're here in this universe. And just looking at this makes this presentation seem so insignificant. But here we are with all of our foot pain, and we're still in this together. So a broader view of this is what's happening elsewhere. So I did I tried to pull some key research findings with this, and I always take research with a grain of salt, but I just want to just point out some key concepts with this, which I think in my mind is, I guess maybe because I've been in this as long as I have, it feels like it's common sense, but this is at least numbers that back it. So what I'm looking at here, so at least the first one right here, so it just says a strong correlation between the severity of flat foot and symptoms of knee osteoarthritis. So basically what the study was doing was looking at patients who had osteoarthritis of the knee, and of all of those 95, 76% of them had flat feet. I don't think that's coincidence, meaning their feet probably have just lost strength and stability with them. But the thing is that all of those that had that type of foot had higher levels of knee pain. So the thing is that we start to see where I mentioned like those problems start going upstream. This is where we start to see that like the next step up is the knee. Doesn't mean you're going to for sure have knee problems with it. Sometimes we've seen it from the top down. I've had people who've had knee injuries and then started to develop foot problems with that. So actually one of the case studies near the end here. So with this, there's that absolute direct correlation with this on how things are starting to get pieced together with it, at least from a statistical standpoint. Um, and then this other one here, high prevalence of foot problems in the Danish population. It's those damn wooden shoes. I'm telling you, those wooden shoes with the Danish, this is probably what they should have been studying. But what they found with this is that they took a study of Danish people who had foot pain and they were surveying them and say, okay, you have foot pain, but throughout the course of any given month, do you have pain anywhere else? And 55% reported, yes, I have pain in the leg or the back or just, increased foot pain with it. So, and I think just about everyone else here tonight pretty much mentioned, or at least not everyone mentioned, but a lot of people did that. There's other problems going on in the body, and that's what we're also trying to really get that broader view of with this. It's not just hiding in the foot and the ankle when you have problems there. So not every problem is really created equally, even though there's common threads. So if we look at the diagram on the left here, when you look at the words at the bottom, it says excessive pronation of the foot. And pronation is demonized in the foot and ankle world. Like, oh my gosh, you pronate, you need orthotics. I can't believe you pronate. We need pronation. When we get excessive pronation, or if we get compensated pronation because we're really not getting it from the feet, we're going to see this way up the chain here too. So you can see here, like the knee's going to move either inward, or our shin bone is going to start to rotate a certain way, or our hips are going to start rotating a certain way, which is then going to change the orientation of our pelvis. Or we got in the middle here, we got the high heel wear as to where that low back pain is coming from, possibly in that individual. You can see that extra arch of the low back with that. And they may have Achilles tendonitis because they just have really tight calves. Or we get, this is just a straight just copy from our foot scan that shows someone's algorithm of what their body may look like with a compensated foot. We may have someone who's got one foot that's got plantar fasciitis, the other foot's fine. Doesn't mean we don't look at both of them, but one foot may need a little bit more than the other with that. So we also want to say not every problem is created equally, because there's common threads, but it doesn't necessarily have to be a cookie cutter or one size fits all approach. The common thread is that really everything works best when working together. So as for me, I love music. So like the symphony, we're not going to have necessarily like, half the orchestra playing, one symphony by Bach while the other one plays a symphony by Beethoven. It's going to sound terrible, and it's not, and people aren't going to do it, and it's going to be awkward. Same thing here, like this person is walking. I was thinking about just what other slide to put on here to demonstrate it, but I was looking at maybe machinery, but just walking. There's a lot of things that got to go with walking, between how our foot has to be rigid and then pliable and then rigid, and then our pelvis needs to rotate and our spine needs to rotate. So everything works best when working together with that. It's not just an isolated problem. So as we talk about things working better together, here's some studies that we'll talk about the effects of the first one here, strengthening the foot, just the foot, and then strengthening the feet and the glutes, and the effects on, they were looking at navicular drop, which is the fancy way of saying how much your arch collapses on you. So what this study was saying was that they took a group of people, strengthened their feet for 4 weeks, 33% had reduced arch collapse. That's pretty good. But then there's the other group that strengthened the feet and the glutes, and a 68% reduction by it. I don't think that really should be that much, in my opinion, that surprising with it, but it's really great to see that the numbers and the research backs it up. And so the thing is that we say, okay, then you just need strong glutes. All right, let's just get your glutes firing, and then they'll fix the problem. Well, what happens if you got a history of some back pain or SI joint pain, or you got like hip tendonitis? Well, we got to get those muscles a little bit of a foundation as well. So here's a study that talks about the glute activation can increase significantly more. And this study showed greater than 100% when working with the core. So meaning like once the core is working properly, the glutes can work so much better, and then that effect is felt all throughout the body here. So the core, I'm going to pass this off to Elise just for the next couple slides. She's going to get into just a couple pieces of the core here. Then we're going to keep rolling. Oh, wait, sorry, Elise, I'm going to do this one quick slide here. Then you're up next. So really quick here, the unfair ask and the blame game. So we're just talking about right now the chain reaction here. We were talking about the glutes, the core, the feet, or even like, yeah, kind of just like the low back when I talk about core. So hearing all that, is it really fair to expect our feet to work optimally when others aren't doing their job? So if the feet and the glutes are co-workers and they're carrying heavy boxes and the glutes aren't carrying the load, the feet are going to get irritated. Oh, but then the glutes are saying, "Oh no, no, no! This ain't my fault. The core's not doing its job, so I can't do my job." And then there's that sore back saying, "The heck with you both. Like I hurt, and I'm mad at both you guys." And there they are, just all pointing fingers at each other right there. And in the sense, they're all the same Spider-Man or body. So it's one system with that. Okay, very good. I got you now, Elise.
Okay, yeah. So as Jeremy's mentioned, it all goes together. So with that, he's been talking about like low back, core, glutes, all that. So talking a little bit more about your core, with what makes up your core. So it's basically like your foundation piece for going all the way up to your head and then all the way down to our feet. And so it makes up a large portion of all the stability muscles that we need in everyday things like walking. So our transverse abdominis, our pelvic floor, and then, your obliques and your six pack muscles. They all play into the foundational pieces of your core to help your stability and help you in things with your feet, like walking. So your pelvic floor, I know this is a foot and ankle course, so you guys are probably like, why are we talking about this? But as we just said, with it being the foundational piece, it does play a huge role into your feet. And like Jeremy showed in past pictures, where if that foot is rolled really in, then it affects the knee, goes to the hip, and that's a direct correlation on our pelvic floor. So these muscles can be too tight, too weak, not contracting or relaxing properly when we need them to work, even not just not working, but just not working in the right way that we need them to. And retraining these muscles allow us to support our body in a way bigger way that we don't even realize we're missing always. So how this relates kind of back to the feet is with, just like Jeremy was talking about earlier, it all flows together. So foot changes, like that dropped, overpronated foot, has a direct correlation on that hip and then doesn't allow our pelvic floor to fire and work as it should. So that can change hip alignment, and then that can create imbalances and instability in the pelvic floor, so that we're not getting that foundational piece we need. And then another study was just that the pelvic floor does activate while we're walking and jogging. So again, something where to Jeremy or I might seem like common sense, but you do use your core and your pelvic floor in everyday activities, whether that's walking or, going for a run, working out, lifting kids off the floor, grandkids, young kids, anything like that. That all requires using our pelvic floor for stability and to help our body in the best way possible.
So yeah, thanks, Elise. So again, like you
Mhm.
guys, like the reason the pelvic floor is in here, not only is Elise is one of our pelvic floor specialists, but the thing is that the pelvic floor is really considered the bottom part of our core. And
Mhm.
so it's just more so that like if someone, you know, it's something just to consider. Sometimes
Mhm.
someone may not have it on the radar that their pelvic floor issues may have correlation with their feet with it. It's just trying to just get you to open your eyes to a little bit more of a correlation with that. But we're not necessarily having everyone in here doing pelvic floor therapy who are coming in for foot problems with it, but it is something to consider that actually could be have a high prominence to other parts of the body and to the feet as well.
Mhm.
So. All right. So what's the solution? What's the solution? So, man, if it'd just be easy as old Hagrid over here saying to Harry Potter, "You're a wizard, Harry," and the spell for this is Fixus Helix Valgusis. For all those who the joke just went way over your head, Helix Valgus is a medical term for a bunion. And really, like it's learning how to take care of your body and getting to the root cause. So building a stronger foundation for your feet, your hips, and your core, and learning your specific imbalances, because other people are going to have, it's not always apples to apples as to what's driving their problem versus to someone else's with it. There could still be common threads, but it's never exactly 100% the same with that. So you're learning different foundational body principles between alignment, mobility, and stability, and learning how to strengthen into functional movements so that you can walk and move better. So it's good to have controlled exercises, and you absolutely need that so you can retrain areas to work together, to start firing together, and just getting that symphony retrained a little bit more, but we do want to get you back into standing exercises where those muscles are firing with your feet underneath you and getting into things where we can actually get you to rotate your body or just be able to do a squat and be able to let that hip actually do the proper movement to get into that squat so you're not losing those feet are like you're doing a squat and those toes are coming up off the ground, which actually diminishes your stability immensely with that. So you want to make sure that you're looking at those specific things to your body, but looking at foundational principles for your body. So getting to the root cause. So then what does that typically kind of look like with that? So usually what we look at is number one is we want to get you out of pain with that. And so whether that be like decreased like muscle tightness or spasms, and that could be myofascial release, which it was a big part of my journey, or dry needling is one of the treatments that I still do as well, cupping, pelvic rebalancing. Then start getting to the root causes of it, restoring symmetry to the pelvis and restoring stability to the core and the feet and the ankles with it. Some of these areas start to overlap anyway, so we don't just necessarily say you're in step one, you're step two, you're step three. So this is not like an absolute thing. There's blending between all of these. Because then when you look at step three, though, like we're trying to get you to strengthen and do functional movements and move better for longer term results. So you get stronger and you learn how to walk and move better. So it's a positive reinforcing cycle during the day. Build out your toolkit. So you have tools for life. You know what? We all have a history. We might have surgeries. We might have fusions. We might have whatever. And you might say something like, I can do this, but like if I do it for long periods of time, like, like what we've worked on, I'm better, but it can still fluctuate on me. Well, if it does, what's that worth to you to be able to actually know how to take care of your body, be on a trip and say, you know what, after being on that long airline ride and then doing that tour, my back's bothering me, my foot's bothering me. Well, what's that to you then to be able to like, oh, I know what's going on with my body. Let me do some of these exercises and you get back into that trip and you're not missing that time and stepping back from life. So then step four, we just really want to build a solid game plan together. Keep you feeling better long term. Enjoy your life and time with family and friends. And that could depend on each one, what they're into. So that's where we just put in there, whether it be home program, Pilates, yoga, gym, workout classes. Sometimes we might make some recommendations depending on the individual, but some person might say, you know what, no, like I really like being at the gym. I like lifting. Okay, great. Let's formulate a game plan. Let's make sure that you're doing things properly. You have the right foundational pieces with it, and you got your symptom relief toolkit in case something happens for you with that. Tools for life. Tools for life. So the good news with all of this is going back to that term mechanical. Like it's a mechanical issue. And so even research-based says that it is estimated that 80 to 90% of foot pain is mechanical. I didn't put it in here, but what's the other 10 to 20%? The 10 to 20%, that's like sometimes like your rheumatoid arthritis. Those are your genetic factors with it. Those are um, man, those can be sometimes like, like a significant injury, significant traumas that like, hey, maybe we needed to have hardware put in us with it. Those are sometimes some of those things that we kind of maybe butt up against a little bit of a ceiling with it, but still to take you from here to here is better than having you here than rather than hanging out at this lower point there. And so 80 to 90% estimated, even from research base, is mechanical issues when it comes to this. So which means that by addressing your alignment, your stability, your mobility, it can greatly improve your foot, your body, your pain, and your life. And that means even if you've had surgery or even if you've told you need surgery as well with that. And at times, surgery, sometimes it gets to the point where surgery is a necessity with it. But regardless, though, you still want to make sure that we're not going down that slippery slope. If I have this one surgery, oh, now I'm in line for this other one. Oh boy, now something else is going, and now I have this one, and then you just end up just slippery sliding down that slope for that last half of life. No thanks. So putting it all together, starting at the feet. So we were just talking about the mechanical pieces, the mechanical drivers. So we're going to talk more so locally with this right now. So number one, your toes and your forefoot are being compressed together, changing the foot alignment, mobility, and strength, especially those little muscles inside there. Two, your foot and ankle cannot change shape. We mean pronation and supination. They can't do that very well. With each step we take, pronation and supination, really by design and nature, is happening with every single step. And then even just as this picture shows here, like the way nature designed us, like to be able to change foot shape, like this is what we were really meant to be doing, walking on uneven surfaces and being able to actually let those feet change shape and actually be able to stimulate a lot of those different muscles with that. So three, muscles in your feet and calves, they're weak. They're not supporting you. They're not allowing you to push off better, or you're not giving you the stability to go up the stairs. They're so weak that they're overstraining your plantar fascia or your Achilles tendon or your neuromas. You name it, it all goes into it. Um, your ankle, number four, your ankle is stiff. So that means at the joint and in the muscles of the calves with that. So that's not allowing you to move properly into that dorsiflexion, which is the ability of once you take that step to allow that shin bone to go over that. You know, looking back, I should have had a good visual of the mechanics of that dorsiflexion. But basically, if you think of a calf stretch, that is dorsiflexion. And then number five, the joint of your big toe is stiff. In some areas of medicine, they say that is the most important joint in our body. So going into each one of these with a little bit of a mini breakdown with it. So the shape of our feet. So with our shape being more narrow, causing local and upstream changes with that. As I mentioned before, the forefoot should be the widest portion of our feet, not the narrowest. So a solution, open up your feet. At times we need to start with a passive approach with it. Sometimes we'll recommend toe separators, toe splayers with that. So I always like the kind, like in this picture here, I like the kind that you can have it on your feet and still be able to move and walk around the house. They do have some brands out there that you could they're really thick and they go on there and they still help stretch out the toes, but you really can't move with them on there. What we really want to do though is we want to be able to train the feet to actually be able to have those feet splay back out and retrain that ability for all those muscles and nerves and all those things to reawaken. And so I like the kind of toe spreaders that actually allow you to be on your feet. Um, Active toe splaying. So it's one good thing to stretch it. It's another thing to start just using the muscles. Start doing this. Open up those toes a bit. And for everyone who's here at the class tonight, you guys will be getting a PDF of this. So don't try to memorize like, what was he saying I should be doing with this? You guys are going to get a PDF of this. And then rolling the ball on the bottom of the foot. I'm sure most everyone has done this who's got plantar fasciitis, but just the ability to just kind of let that ball to kind of start opening up not only the tissue, but the joints. 33 joints. It's on the quiz. Your feet need to change shape. So with the problem, your feet are too stiff from either not moving or being in stiff shoes while walking on man-made surfaces, meaning flat surfaces. The foot should be able to supinate, as I mentioned, and pronate for each step. So as we hit the heel strike, it should be rigid, and as we go push off, it should be rigid again. So it always alternates between rigid of supination, pronation pliable, and supination, which all happens within each step we take. So with that solution, we're going to go back to the ball again, just rolling on a ball. For someone who's a little bit more further beyond that, sometimes just walking on uneven ground with a little bit less support, meaning maybe less supportive shoe, or if someone can tolerate bare feet or they have barefoot shoes. Either way, something that allows you to actually get that stimulation on the ground. Your feet and ankles need strength. That has come up a lot. So with the problem, your feet and or calves are weak from too much sitting, whether it be disuse from overall activity. And its natural design of really being able to walk on an uneven surface. It's just changed our bodies so much. So the muscles in the feet are really like a springboard, and they really need that. And they are the ones that really support our feet when we're pushing off, when we're walking. As I mentioned, that is a more recent change in the research. And that previous research was decades and decades and decades, meaning like probably like 60, 70 years, if not longer. So we want that support from the muscles. So solution. A good starter spot with that is we want some arch building exercises. Sometimes people will do towel scrunches. Nothing wrong with towel scrunches. Just make sure that if anyone's ever doing an arch exercise, it's not just trying to get the toes, it's trying to get that heel and the forefoot to try and come together with that. So whether you're pulling the toes into it or not, we want to try to use the muscles to try and create a little bit of an arch. Calf raises, I put calf raises with the ball on there. Sometimes we find that depending on someone's individual findings with it, but it can really wake up some other key underactive muscles that really support the foot and ankle. So it's just a general catch-all. Put the foot and the ball in there with it because it really can make more muscles activated and actually support the foot and ankles more. And then single leg balance, just single leg balance. Like I want to say just single leg balance, like the nuances make such a huge difference, guys. Like the thing of like, hey, my balance is bad. I'm just going to stand on one foot. Great. Like better than nothing. But what is it to you if you can engage your feet, engage your muscles in there, have the tripod of your foot, which we did not get into, but have the tripod of your foot have a good contact with the ground, and then be able to have your core engaged so you actually feel like you can be supported at the top and the bottom. Exercises, sometimes it's not a bad exercise, it's how you do it, your intention, your nuances that can make an immense difference of actually what you're getting out of it. Open up the ankles and the calves with that. So we talk about tight calves, tight ankles, that dorsiflexion. There's that dorsiflexion movement. You can see that just with the angle of those calves being stretched there with it. It is a key movement that can drive many problems upstream in the body, especially if there's an asymmetry. And we see this a lot. One side moves pretty good, the other side is stuck, and then their pelvis is all off kilter, and that goes all the way up to the neck. So solution, stretch the calves. There's actually two muscles in your calves. There's a gastroc and a soleus. One has the knee straight in the back. The other one has the knee a little bit bent in the back. So there's actually two different muscles in there. So not all calf stretches are created equal, guys. And then this is just a little nuance I just wanted to put on there with it. Oftentimes when people have really tight calves and tight ankles, one of the things that really needs to be addressed is once you start opening it up, is you want to try to load that range. So load that range, meaning like once you stretch it, the body needs to integrate that into its movement. So I put in there just toe raises to just start as basic as possible with that, but something that whether it's doing toe raises, maybe doing a little bit of a squat or a lunge or doing some step ups with it, depending on where you're at on your journey with that. Once you create that range, you want to be able to have something that starts to load that range so that body starts integrating that range into its movement pattern rather than just going back to saying, nope, I'm tight. Get the big toe moving. So problem is the big toe is just getting stiff and rigid from factors such as stiff ankles and weak feet. This is considered one of the most important joints in the human body. And really, we should be learning to load through this joint for walking as well as with exercises such as calf raises. Again, the nuances that make such a huge difference. We'll get someone in here, oh, I got calf raises from my PT. Let me see you do it. They come up on their toes, they're rolling to the outside, they're compensating. They're actually creating, it's better than doing nothing, but that compensation is actually feeding into the problem on some level with that. Just the little this cue of like, hey, let's just get your feet a little bit more level here, and let's just see if you can feel thousands of nerve endings, guys. Can we just get you to feel it? You're actually putting pressure through the base of that big toe joint there. Oh, you can't do that? Okay, that's a big problem. So the nuances that make such a huge difference with that. And then just another thing one can do in terms of solution, stretch out the big toe, and then a little yoga, little toe yoga. This is way harder than it looks. Keeping the lesser toes down and lifting the big toe up. So just and that can help strengthen some of the toes and the muscles in the foot as well. So anyways, beyond the big three, a couple bonus tips here. When walking, trying to feel pushing off to the joint of the big toe, mention that. When walking, try to move and rotate through your upper body. This allows for increased core activity as well as force generation for better propulsion to move the body forward with it. And I talked about glutes a lot, so I just put one basic exercise in there in the PDF of just a bridge, just as one of those basic ways to start waking up your glutes. All right, two more tips. Everyone who is here, you're all awesome. Thank you. Thank you so much for being here. And also, like this little man says, you got this. A couple real quick patient stories here. These are real patients here where first one here, 55-year-old female, very avid outdoor enthusiast, skiing, hiking, stand-up paddleboarding, biker. She had a ski injury to her knee. Never had problems with her feet until she had a knee injury. Torn meniscus from skiing, had surgery, then 8 months later developed plantar fasciitis. So she had a year of this, had over 30 PT sessions. She came in with no relief. They were doing all the right things. They were doing like, calf, some calf stuff, but there was other things going on. She needed glutes, she needed forefoot muscles, and she had really tight ankles, but she was not loading them afterwards. So we did it. So the approach was we targeted ankle mobility, loaded it with squats, lunges, balance exercises. She was much higher level, so we were able to get into these a lot sooner. Targeted glute strengthening, and she also needed orthotics. She worked on her feet all day. As much as we talk about strengthening in the feet, there's times where we need that extra support. Orthotics were a big part of her plan to be able to get back to work and be on her feet for a full work shift. 4 years later, she is still pain-free, still skiing, still hiking. Another story, 48-year-old active mother of three, just like more so just walking, biking, gym goer. Developed pain in both feet that continued to just worsen, just kind of general gradual onset. But she also had history, low back pain, pelvic floor, and plantar fasciitis from years ago. Key findings, uneven pelvis, weak core and glutes, and weak calves. So the approach started with calf strengthening and stretching. And sometimes, guys, there can be quick wins. Can't always guarantee it, but they exist. So this one right here, within 2 to 3 sessions, about 80% of the foot pain went away just with the stretching and strengthening alone. And then we shifted more to working towards pelvic alignment and glute and core strengthening. Outcome, improved foot, back, and pelvic pains. It's all connected. Continues to maintain progress, not missing her workouts from the pain. A couple of quick things from just Google reviews. Suffered with plantar fasciitis for more than 6 months, affecting the gait. And let me just move this so I can, I'm sorry, it's moving my screen from where I can see you guys so I can see this. Is affecting the gait and hips. Balance within PT, was able to get past this in a few quick months. I am back to golfing, hiking, and traveling thanks to balance within. Another one, I'm an active person that likes to bike, hike, and ski, developed plantar fasciitis in both feet. Doctor was talking about surgery. Taking extra time to look back into the history. It was a long recovery due to my other issues that were found, but happy to say I can work a full day on my feet. No pain with hiking, biking, and skiing again. Couldn't be happier. We all have a history, guys. We all have a history. We always have one pain that brings someone in through the doors here, but we all have a history with it. And sometimes if we're just looking at like, what do I need to do to fix my feet? And my question is, where else do you hurt? What else has been going on in your past? Makes a big difference. And then the last one, I've used balance within multiple times over the last several years, and each time I walk away with positive results and the initial problem gone. Most recently went for stiff and painful feet. Jeremy and Elise were able to end the pain with exercises and other modalities. The exercises have been super easy to incorporate into my daily routine without adding more to my to-do list. The whole team is wonderful. I couldn't agree more, but I am definitely biased. All right, a reminder, still going to have a treatment session raffle. We'll do the raffle afterwards because I know this is already coming down to the end here. Type I'm still here into the chat box to be entered for this drawing now. And then talked a little bit about our approach, but still, what's it like working with any of the team members that balance within? So the way we do things is we do 55-minute one-on-one sessions with the foot and ankle. I should just say body specialist. We look at full body assessments and the evaluation to assess where the quick wins are and what's most readily apparent. Learning what your goals are so that we can direct that plan of care towards them with it. Because sometimes we come in and it's just like, you know what, I got all these problems, but this is the one that limits me the most, or I got a trip coming up in 4 weeks. Just had a gal, my first time seeing her back today. She went to Thailand for a month. She came in with extreme back pain. We're like, she's like, whether I go on the trip or not, like I've come to terms with it, but we're like, no, we're gonna keep you on it and keep on the path. She was on that trip. So the thing is, sometimes we're working towards a short-term goal and a long-term goal with that, and that may change how we're doing our sessions. Specialized hands-on care. I don't always want to overemphasize like the use of the hands, but the thing is sometimes for when people are working in a traditional setting, you may not get soft tissue work from the hands with it. And I don't want to say that hands are the end all with it, but at times, if you maybe are not getting hands-on work and you're not opening up some certain tissues that are restricted on you, it may be one of your missing links. So whether it be myofascial release, manual therapy such as joint mobilization, um, or pelvic rebalancing, or cupping, or dry needling, et cetera. Like all of that really sometimes can be a big thing about getting you out of pain and getting you out of that cycle so that we can do those strengthening exercises so you're not hurting so much, to actually be able to do what's being asked of you or being asked of your body. We want a tailored home program for your body to empower you to handle all of life's fluctuations and keep you moving towards your goals. And then again, I love this term, you're learning tools for life to help keep you feeling better and living your best life. So special free discovery visit offer. Um, we have a reserved one slot this month for a free discovery visit for each of you in the room here. The purpose of this is just for, and some of you guys have already taken advantage of this and done this, but there's some of you who have not. So this is more so just an opportunity for a one-on-one session where we can actually listen to your story, go over your goals, and really just have more of an opportunity to make a more personalized opportunity to give you the opportunity to hear what we're see to hear what we're seeing and give you that pathway to get you from one point A to point B. And it's really just no pressure visit to just really just see about getting your questions answered to your specific situation and see what your options are with it. So this will be opened up to the public tomorrow because we have people on the replay with it. So anticipate that these probably will go quickly. So again, we did have a large wait list for the replay and the workshop. So if you're ready taking the first step to be here and this is your first point of contact here, you're doing great. Shows really you made a commitment to yourself with this. So I'd say let's get you booked in for your free visit and just get things moving in the right direction. No pressure whether you work with us or not with that. Again, we just, let's start looking at this more so just speaking with us as the foot and ankle specialist with it, troubleshooting your symptoms with it, hearing your story, getting your options, get more information so you have better clarity of what can be done for you and get you moving comfortably again. And honestly, we know what it's like to feel stuck because, as I mentioned, we are not just practitioners, we're patients. We all have our own history. We all have our own problems with this. So it's just making sure that everyone can make a good informed decision for themselves with it. And we just really want to be a resource for you guys, regardless of whether we work together or not. All right, an extra bonus for scheduling the free consult now is that when you do that, you get to unlock, turn back the clock pricing, unlock 2022 pricing on packages and orthotics. Honestly, never a better price on any of these products and services with it, but it is an opportunity for you to, just for the ones who really showed up here tonight, to get an opportunity to get 2022 pricing on that. And as the king always said, like you very much. I appreciate everyone for taking the time out of your evenings to be here tonight. I know we're coming down to the end.